Mersey Care started on our journey towards implementing a just culture probably about 2 years ago now. And really it started from was we were having lots of conversations with our staff to understand from them what the barriers were for them delivering the best care that they can possibly give. And really when we started to get in and talk to our clinical colleagues and clinicians particularly, the feedback was overwhelmingly about fear of blame if things didn't go well or as they wanted it to go, that they would actually get blamed for something going wrong. And that was preventing them from telling us things in the first place, and actually more important to us, it was actually preventing the opportunity for us to learn from those things and prevent those things happening again, particularly in clinical environment. And I think our chief exec brought in one of Sidney Decker's book, and we all started to read it, and really that started to prompt a conversation. Are we looking at things in the wrong way? Should we be trying a different approach with our culture within our organisation? So some of the key things that we've done when we focused on what we could concentrate on our year one priorities for a just culture, we engaged our workforce. We asked them to identify what those themes were, and there was 3 themes that came out really. One was our 72-hour review process, and the feedback there was it never happened within 72 hours. The right people weren't engaged in that process or involved, and there was absolutely a perception that the 72-hour review could lead and would lead to a disciplinary process. So that was one key aspect. The other aspect was actually about sharing learning stories, so good experiences and experiences where there could be real learning and momentum gained. That staff were saying to us they'd heard something had happened over here or something had happened over here, but it was all hearsay and they weren't getting that benefit of the learning. And then the third priority for us, particularly as a mental health organisation, was that our staff were saying when they were injured in the workplace, and that could be because of an accident in the workplace or it could be because of an incident where they were injured, that they didn't feel supported. And that was really disappointing for us as an organisation. So we developed a staff supporting process and engagement process that really started to focus on what more we could do to support colleagues when things haven't gone as planned or as expected in the workplace. Well, one of the biggest learning from what we've done, I think, has been our approach to our 72-hour review process, how that's led on to a root cause analysis if needed, and also our disciplinary processes. So I think our 72-hour review processes, what we've done is we've done it in a far more supportive way. We've engaged with multidisciplinary teams, we've listened to them, we've reflected what they say with their words, their terminology. We haven't paraphrased it within the 72-hour review process. So that's been a real focus for us, and it is happening within 72 hours, which is key, and the feedback's going as well. The other thing we've really concentrated on is actually when something goes wrong in the organisation, or our new terminology is when it doesn't go as expected or as planned. That doesn't automatically mean that somebody has done something wrong. We need to get to a place of understanding. So now we ask an awful lot of questions, different questions, lots of open-ended questions, trying to understand what happened to get to a real place of understanding. And that has actually led to a nosedive of disciplinary investigations, far less suspensions within the organisation, and far less disciplinary processes. We've rewritten our disciplinary processes with staff side fully engaged and involved, and actually staff side now, our last engagement session, are really saying that they start to see the evidence that we're putting patient safety and staff safety at equal parallel in the organisation. So there's been a real shift, I think, and a real change in mindset in how we approach those circumstances. I think one of the key things if other organisations are interested in looking at just culture is they really need to ask why, and ask not just the senior management team, but ask the organisation, what they think. There's lots of evidence sources out there in terms of your workforce KPIs, staff survey results, but there's nothing better than getting your senior team going out and saying what prevents you delivering safe and great patient care. Listen to what your staff say and then ask the question, is a just culture approach right for your organisation? There's lots of evidence out there that it is. I believe it's fundamental into delivering great patient safe care, but also a fantastic and safe place for our staff.